Demand for health care is growing fast, and some communities across the state, whether they're rural or urban, don't have the same access to doctors that others have.
And that's where providers like nurse practitioners come in. They're not doctors, but they can provide more care than a registered nurse while under the oversight of a doctor. But when the pandemic started, Governor Edwards temporarily suspended that oversight requirement. And now a bill in the state legislature would make that change permanent. Meg Ferris has both sides of the debate.
To understand each side, we turn to President of the Louisiana Association of Nurse Practitioners and President of Louisiana State Medical Society. For the bill, nurse practitioners want to provide health care within their scope of training without being required to pay a doctor who agrees to be available if needed.
They make out like this collaborative practice agreement provides this safety net. It does not.
Against the bill, doctors say nurse practitioners would be practicing medicine without the oversight of the State Board of Medical Examiners.
I have seen really dangerous practices coming from nurse practitioners that haven't had the proper training, but yet making a lot of money from it.
Nurse practitioners say they're accountable to the Board of Nursing and the patients. They say it's about access, especially in rural parishes. Their clinics are often the only place people on Medicaid and Medicare can get health care. And there are fewer doctors available to collaborate with them. She cited one example.
That something happens to his physician, all 5 clinics shut down. That means that all the patients, which is almost the entire parish, doesn't have access to care.
The doctors say nurse practitioners were not willing to restrict the bill to rural areas.
About 87% of nurse practitioners are in the urban communities. A lot of times they will come in the urban communities and practice in ways that they were not trained for.
Nurse practitioners say more than 24 other states have enacted this without patient safety problems.
And in Louisiana, we're 50th in health outcomes. We need all boots on the ground.
The doctors say big hospital corporations are replacing MDs with nurse practitioners to save money.
Med school matters. This bill does not protect the public, and it's very concerning to physicians.
Meg Ferris, Eyewitness News.
Now, the bill passed the full House. An amended version passed the State Senate Health and Welfare Committee, and next the whole Senate could vote on the measure as early as this week.